Assalamualaikum warahmatullahi wabarakatuh. Dr. Tedros Ghebreyesus, Director General of the World Health Organization, Her Excellency Dasho Wangmo, President of the 74th World Health Assembly, distinguished delegates and participants, let me begin by thanking Dr. Ghebreyesus for giving me the honor and opportunity to address the closing session of the 74th World Health Assembly. The theme of the Assembly for this year is apt. Global resilience requires us to not only address the current crisis, but also protect our people from future pandemics. Malaysia applauds the World Health Organization for designating 2021 as the International Year of Health and Care Workers. We are humbled by their abundant sacrifices. We are in awe of their courage and fortitude in the fight against COVID-19. We owe the healthcare frontliners of the world a debt of gratitude, including in Malaysia. We have saved countless lives and the futures of generations. From the beginning of the pandemic, Malaysia took a whole of government and a whole of society approach based on scientific data and public health recommendations in addressing the unprecedented health crisis. We executed a clear strategy which focused on three thrusts: expanding our healthcare delivery system to prevent spread and to tend to the infected, providing strategic fiscal injections to safeguard the economy, and protecting the people's livelihoods. In improving our healthcare delivery system, we empowered the Ministry of Health to be at the forefront of the pandemic response. The Malaysian government swiftly increased budget allocations, and to date we have spent 69.3 billion ringgit, roughly 16.7 billion US dollars, on boosting healthcare capacity, which constitute 4.89% of GDP. It is the largest and most acute rise in spending for public healthcare in Malaysian history. And this also includes investments in the wider use of technology, from contact tracings and digital vaccination certificates on handheld mobile devices, blockchain for vaccination management system, to the use of artificial intelligence and machine learning to identify hotspots for outbreak of disease. The COVID-19 pandemic continued to challenge us in so many ways. Aerosol transmission, multiple variants, and pandemic fatigue have made containment of the infection difficult, especially for countries like Malaysia, where our economy is driven by small and medium enterprises in our multi-racial demography, where culture is diverse. The only hope for our world to end this pandemic is to ensure as many people as possible are vaccinated as rapidly as possible. Now, even as I speak, Malaysia, like many other countries globally, is facing another surge in cases. Our healthcare frontliners are once again under tremendous pressure, and the resilience of our healthcare systems are being tested day by day, and thankfully holding up thus far. Malaysia reiterates its call for universal access to COVID-19 vaccines. These vaccines must be affordable and accessible to all. We joined the COVAX facility to facilitate the equitable distribution of COVID-19 vaccines globally and commend the WHO for spearheading this effort. I'm delighted to note that Malaysia has started receiving the delivery of the vaccines procured through COVAX. But unlike countries from the West, we have to wait for our supplies initially trickling in, which brings me to this. We can only be safe when everyone is safe. Vaccine equity is still a major issue, and we cannot win this war against the virus unless everyone has equal and rapid access to vaccines. Malaysia's commitment to universal health care extends to its non-citizens. The government of Malaysia continues to provide free health screening and treatment for COVID-19 infections, and will offer free vaccination to everyone in our country, whatever their citizenship or immigration status. Since last February, under the Malaysia's National COVID-19 Immunization Program, we have successfully inoculated just over 5% only of our population. And this is nowhere as fast as we had hoped, but our pace is very much dependent on the supply and delivery of vaccines from the manufacturers. Malaysia requires 53 million doses of vaccine to meet the needs of 70% of its population. And to date, we have only received just under 3.2 million doses, or 6% of our required doses. And with the expected arrivals of more vaccines the next couple of months, we hope to increase our daily vaccination rate from 100,000 to between 200 and 300,000 per day, so Malaysia can achieve herd immunity against COVID-19 before the end of this year. Malaysia is scaling up vaccinations through public and private health partnerships, and also implementing many good practices observed from other countries, from the citizen engagement and outreach of countries like Bhutan, drive-through vaccination as in Arizona, USA, to the use of mega vaccination sites from now underutilized convention centers and stadiums, and also done by our neighbors in Thailand and in many other countries in the region. The rollout of the vaccination offers hope for us to win the war on COVID-19. It has already evidently done so much in wealthy countries which have an abundant access to vaccine, but we need all countries to have the same opportunity. Distinguished participants, Malaysia is very grateful for the confidence placed in us by the member states of the Western Pacific region as a new incoming member of WHO's Executive Board. We are committed to working closely with the WHO and other countries in strategic partnerships as guided by the General Program of Work 13 to achieve universal health coverage, address health emergencies, and promote healthier population in line with the 2030 agenda of the Sustainable Development Goal. I would be remiss if I did not take this opportunity to address some less mentioned concerns. Firstly, the impact of this pandemic on mental health and social well-being. There is nothing natural about self-isolation and the toll it takes on our global citizens, young and old, the disruptions to education, work, and social norms. It will require us to endure a healing process that will take time. Secondly, the findings from the Independent Panel for Pandemic preparedness and response has given us clear analysis and recommendation so that together we can make this the last pandemic. While we must commit to taking actions and ensuring multilateral cooperations and commitment to achieve this goal, let us also not forget that the rise in zoonosis and pandemic risk has a direct correlation with transgressions of our planetary boundaries, and our future development must consider the protection and the health of our planet. While the end to the COVID-19 pandemic may still be some time away, we in Malaysia hope that the global situation will continue to improve. Imagine the benefit to all of humanity if only more vaccines were immediately made available to people in need across the globe. We welcome the call for people's vaccine and trade-related intellectual property rights or TRIPS waiver to allow vaccine manufacturing in the developing world. This is a fight we cannot afford to lose. You can certainly count on Malaysia being a strong partner to WHO to create a healthier, happier, and more equitable world for all. But thank you.